Jordan Alninger, and my field of study for ISM this year is physical therapy. Some people choose physical therapy to help others, to improve their lives. Others go into physical therapy for the money. But the reason I aspire to be a physical therapist someday is because I get to wear athletic clothes to work. Just kidding. Napoleon Hill once said that the starting point of all achievement is desire. Now, what he means by desire is motivation and passion. Because if you don't have motivation, you don't have a direction you want to be in. You don't know where you want to be. But if you don't have passion, you're going to run out of steam halfway through. You're not going to know where you want to be, and you're not going to be willing to achieve it. So you can use this quote through physical therapy because physical therapists have to work with the patients. They have to desire to make them better, to make them stronger, and the person receiving the physical therapy also has to desire to get better. So why did I choose independent study mentorship? ISM students are presented the opportunity to explore their dream career before college begins. Now, what high school student gets to say this, and let alone what college student gets to say this? They get a first-hand look with their mentors and gain experience in their fields of study. With this responsibility, you have to know professionalism. You have to be able to network with professionals through the Frisco ISD area, as well as communicate with them. We're trusted to go on research interviews, as well as build a resume. Now, ISM students are unique because they get a different learning approach that allows students a free-form learning style. They get to explore what they want to be. They don't have a set number of anything. So why did I choose sports physical therapy? Sports physical therapists work with athletes to heal their sports-related injuries. There are four main focuses of sports physical therapy, which include prevention, evaluation, treatment and rehabilitation, as well as sports enhancement. Now, prevention goes along the lines with making sure that athletes are stretching and warming up properly before they go out and train, as well as making sure they don't train too hard. The evaluation aspect is when, if they develop an injury, they're sent to a doctor. The doctor then decides, is this a surgical matter or is this something physical therapy can treat? More often than not, the doctor's going to choose physical therapy because it's a less invasive approach, and when they get to the physical therapist's office, the athletes are then assessed for about an hour and a half to 2 hours, where the physical therapist decides what is their course of action and treatment and how long are they going to be in physical therapy for. The treatment process is around 4 to 6 weeks, but athletes can come in maybe just one time to get an at-home exercise program, or up to 6 months, depending on the severity of the injury. Lastly is sports enhancement. This is making sure that the athletes have improved. This makes sense because you don't want them going back and undoing the physical therapy they had done to prevent the injury in the first place. It's making sure they eat right, sleep right, as well as train and not too extensively. This could result in injury and lead to, I don't know, maybe surgery, and nobody wants that. Also, I've done some research on physical therapy, and one of my main areas of focus was shin splints. Shin splints are a common problem in athletes, especially runners. They derive from poor foot and leg biomechanics, as well as wearing improper training shoes while they're exercising. Now, this can be healed with rest, as well as strengthening of the shin muscles, but it's not something physical therapy can really fix. I also studied trigger point dry needling, which is an acupuncture-like procedure, in which the physical therapist repeatedly inserts small needles into a muscle area to try and trigger a muscle spasm. And with enough muscle spasms, the runner or athlete or just any normal human being really will retain more muscle function, as well as the loosening of the muscles, which easily relieves many sources of pain. Now, I've also researched kinesiotaping, which is a certification for athlete trainers as well as physical therapists. And the kinesiotape itself is flexible, which allows for a range of motions while the athlete is training. It's seen as a quick fix almost, because the athlete can train with it while getting pain relief, and it enhances circulatory function. Also, I studied manual therapy, which is a chiropractic approach to physical therapy. This includes mobilization through manipulation, as well as soft tissue work, which is working with a smooth muscle through the use of tools and instruments. So far, I've been on 9 interviews, 2 over the phone and 7 in person, and I'll talk about these for a little bit. Now, I had a phone call interview with Dr. Kerry Gilbert. He's the director of the graduate degree program over at Texas Tech University, and this interview was more to impress him rather than gain info on physical therapy, considering I will be applying for this selected position 4 or 5 years down the road. His focus in physical therapy is more academia, which is helping with students rather than patients, but the way he justifies not helping with patients is that the knowledge he extends to his students will therefore be pushed onto his patients. I also had an interview with Dr. Twyla Selvage of the East Texas Medical Center of Cardiopulmonary Rehabilitation. She's a director there, and she sees patients who have undergone heart and lung surgery, which is mostly older patients, and it's the physical therapy of the heart and lungs. Now, her area of physical therapy is not something I'm necessarily interested in, but it's something I will be open to looking forward into. I had an interview in person with Dr. Michelle Piotrowski of Edge Physical Therapy in McKinney, and her interview was extremely interesting to me because she works with young female athletes, dancers, gymnasts, cheerleaders. These are all people I aim to be working with 10 years down the road from now. Also, I had an interview with Dr. Cody Johnson of Athletic Advantage Physical Therapy, and his interview was less informational and more hands-on as he showed me trigger point dry needling up close in person on one of his patients. So I definitely considered both of them as mentors, but I ended up asking Dr. Michelle Piotrowski, considering she works selectively with young female athletes, and she accepted, so I look forward to working with her this spring. Out of all the physical therapists that I interviewed, I collected some of those common skills that they thought would be useful through physical therapy. This included communication as well as analytical thinking. Now, communication plays a big part in physical therapy because you have to be able to effectively communicate treatment plans with patients. You have to maintain the conversation as well as comfort and gain the patient's trust. Because if the patient doesn't trust in the doctor, then most likely they're going to go find a new doctor who they trust to make them better. Also, analytical thinking, because they design the patient treatment plans. They decide where they're going to be in physical therapy, what exercises they need to be doing on a regular basis, as well as in and out of therapy procedures. And unfortunately, these don't always work, and so the physical therapist will have to assess and problem solve the situation and say, where did we go wrong and how can we make them better? I also got some advice from these physical therapists who told me to basically focus on a science background, anatomy, physiology, biology, as well as keep my GPA above the 3.6 throughout college, because physical therapy graduate school is very competitive and these competitive grades will stand out in the future. Also, they told me to experience different settings of physical therapy, such as pediatrics, orthopedics, women's health, neurology, cardiopulmonary physical therapy, as well as home health, which is working with patients who can't leave their house. I haven't looked into all these yet, but I'm definitely open to learning more about them, considering I may grow up one day and decide maybe sports physical therapy isn't for me and look into one of these other options. I aim to open my own practice when I grow up someday, which is where the business symposium kicks in. Through the business symposium, we took a step back from the physical therapy aspect and the medical aspects and focused more on the business area. And I was advised by professionals in managerial positions who taught me how to form my own physical therapy practice someday. They told me to lay down the groundwork first, to learn everything there was to know about physical therapy as well as sports physical therapy subcategories. After I had that solid basis, then they told me to start, gaining my entrepreneurial skills, developing my business, making sure that the business all around is successful rather than weak. I also got a very key important piece of advice, which is to establish an efficient environment for my employees. Because if my employees don't feel comfortable talking to me and don't feel comfortable communicating with me, then what does that say about my patients? They're probably not going to feel comfortable around me either. So what separates me from the rest? Leadership skills. I served as the social officer of the Red Rhythm dance team last year, which put me in a position over 52 other girls. This taught me communication as well as teamwork. We all had to establish a common goal as well as reach it and attain the team morale to be positive as possible. I also have a knowledge in human anatomy and physiology, which will help me further down the road, and it continues to grow every day. My passion for dance, personal training, and nutrition is something I must have in my future career. I'm all about personal health, and aspiring to help others become healthier and stronger is something I look forward to in my dream career. Lastly, my compassion and empathy. This isn't something people are naturally born with, but mine's 100% organic. I have always desired to help improve others' quality of lives, and I think that is what essentially will lead me to be successful when I grow up. And what separates me from the rest. Thank you.